This is Late Night Health. In a few weeks, we're going to be spending some time with Roni Enton. Roni is a nutritionist. She's based in Tel Aviv. She will be Skyping us and talking to us about some research that she's been doing. She writes a lot about nutrition and children, and those especially with a variety of diseases and disorders. A couple of weeks ago, we talked about. I'm trying to think of the disease. And anyway, we'll be talking about nutrition and disease with Roni Enton just a few weeks here on Late Night Health. We'll also be talking about a Zen acupressure mat. I'm not sure what that is, but we'll find out more in just a couple of weeks here on Late Night Health. Right now we're talking about the flu with Dr. Leonard Friedland from GSK North America. Let's talk about the allergy element. I was asked if I was allergic to eggs. Why are we asked that?
Well, that's a great question. When it comes to influenza vaccines, there's tremendous innovation that's occurring throughout the pharmaceutical industry to develop new vaccines that can offer new opportunities for patients. One, as I mentioned earlier, are these 4-strain vaccines. We call them quadrivalent vaccines that essentially could provide broader protection. And that's an active research area where GSK has been involved, and we now have 2 of these vaccines available. When it comes to allergies, the question about eggs has to do with the way that traditional influenza vaccines are made and are still made for the majority. And this is that the influenza virus, the process is started where the virus is grown in eggs. And the eggs are basically a medium in which the virus is grown into larger quantities. And then the virus is extracted from that medium, purified, and becomes the vaccine. And there are remnants of the egg protein in the process. Now, people who are allergic to eggs, there's a wide variety of what that really means. For somebody who is truly allergic, where if they're even exposed to any egg protein, if they break out in hives, their lips swell, their throat can close up.
Anaphylactic shock.
Right. That type of anaphylaxis, that's a real allergy, and those people absolutely should not have a traditional influenza vaccine that's produced in eggs. There are many other people who have different types of, let's say, less severe allergy, and they can tolerate egg protein. For those who are severely allergic to eggs, this year there is, for the first time, a vaccine that is not produced in eggs, which is 100% free of any egg protein.
Oh, that's good news.
That vaccine is only licensed for people 18 years of age and older. So for those on your audience who are truly allergic to eggs, they should speak to their healthcare provider and see what options are available for them. The interesting thing and the important thing about influenza is that the pharmaceutical industry is not satisfied with what we have. We're always looking to innovate and do better. And the real new thing this year are these 4-strain vaccines that have these 2As and 2B strains, which can have the opportunity to provide even broader protection to the public. And I think that's important because the industry, the pharmaceutical industry, the research scientists, we're not willing to sort of settle for what we have. We want to constantly do better. And it's an exciting time because there's new opportunities for even improved patient care and also for new options for patients as well.
Technology is changing daily, so why not in the pharmaceutical industry? When I was asked that question about 10 years ago, the question about eggs, the first time I took a flu shot, I didn't know the answer, and that's because my mother was not a very good cook, and she just, the egg was so overcooked, it didn't have any taste to me, and I hated eggs. I couldn't answer the question. So I went home, I ate eggs, then I came back the next day. And when they're nice, yolky, runny, I like them. Anyway, in the remaining couple of moments, what should people do if they come down with the flu or a family member comes down with the flu, other than washing your hands and keeping away from that sick person?
Right. That's a good topic to end on. If influenza is circulating in the community and people are getting sick, they should see their doctor to be certain what is the illness, because what you think might be the flu could be something else. So they should see their doctor or at least speak to their doctor about what's happening. If it is influenza as the cause of their illness, the best thing to do is for somebody to remain well hydrated and as best nourished as they possibly can to treat fever and aches and pains with the traditional remedies for fever, aches, and pains. It's also important that they look around their circle of people they're exposed to, and first off, if they think they're well enough to go to work or school and they have influenza, they should not be going to work or school because they don't want to expose other people. But they should also look around and see who's in their circle of exposure and ask, have you been vaccinated yet? And if they haven't, they should refer and recommend that those people go to their doctor or their healthcare provider and be vaccinated, because the best prevention for influenza is the seasonal annual influenza vaccine.
Well, our music is coming up underneath us, and we have to go. Doctor, I appreciate your time today. Thank you very much. If you want information on Dr. Friedland and the vaccine, you can go to the Late Night Health website, go to the guest tab under Leonard. You will find Dr. Leonard Friedland and a link to the website. I'm Mark Alyn. Coming up next, we're going to spend some time with the author of You Were Born to Be Healthy, Dr. Otto Jenke. I'm Mark Alyn. This is Late Night Health.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.